Hi, everyone, and welcome to The Balancing Act. I'm Olga Villaverde.
Hi, and I'm Montel Williams. Today we have three very different stories about our health.
That's right, two very rare diseases and one that we can all relate to.
Balancing Act starts right now.
It's a rare genetic chronic kidney condition characterized by declining kidney function that could lead to end-stage kidney disease.
Wow. Well, all patients experience kidney-related symptoms, and some may experience hearing loss and eye abnormalities. It's also a very highly progressive disease that is often undiagnosed or misdiagnosed.
Today, we're going to hear from one woman whose life was affected and how she became a passionate advocate to help others.
Let's go behind the mystery of Alport syndrome.
I'm a mother of 4 adult children, and I have 3 beautiful grandchildren. I'm a retired dialysis administrator, registered nurse. I've been a nurse for 45 years, once a nurse, always a nurse. Have worked mostly in and around the dialysis community through my career. I graduated from nursing school in 1974, and part of leaving nursing school was to have a wellness exam. They identified that I had blood in my urine, and they accounted to probably just having a menstrual period. But 3 weeks later, in a pre-employment phisicals, I also still had blood in my urine. Also, they identified then protein in my urine. So I was referred to a nephrologist for a workup.
We met with nephrologist Dr. Pablo Pergola in San Antonio, Texas, who specializes in Alport syndrome.
Collagen is the most abundant protein in the body, essential to the function of many organs, and if mutated or missing, it can result in disease. Alport syndrome is a disease that involves a mutation in a specific type of collagen, this type 4 collagen, that can lead to disease in the kidney, eyes, and ears. In many patients, male or female, that kidney function can be lost over time fairly fast. That can result in significant loss of kidney function, requiring dialysis or transplantation.
Alport syndrome is considered one of the most severe types of chronic kidney disease, and compared to other forms, the condition causes a much more rapid progression to end-stage kidney disease.
There are 3 patterns of inheritance for Alport syndrome. One is the X-linked pattern, where the X chromosome is affected, and non-sex-linked pattern. They are the autosomal recessive form and the autosomal dominant form. Symptom presentation and disease severity can vary widely depending on the type of inheritance that you have. And often, many generations of that same family can have the disease.
It's estimated that approximately 30,000 to 60,000 people in the U.S. are affected.
I knew that my mom had blood in her urine and just lived a long life with continuing decline of her kidney function. Her 2 brothers had died of kidney failure. So when I was referred to the nephrologist, he asked a lot of questions about my family history, and he was the one that connected the dots between my symptoms and my mom's family history. I was told that I had Alport syndrome and that I didn't have to worry about it because women are just carriers, which we know, of course, is not true anymore. I continued to be followed by my primary care provider rather than returning to a nephrologist.
Kidney-related symptoms include hematuria, protein or albumin in urine called proteinuria, and progressive loss of kidney function leading to end-stage renal disease.
I did more research into Alport syndrome. I knew that I had had more protein in my urine. When I started seeing my new nephrologist, she wanted to confirm to be sure that she was going to be monitoring and treating me appropriately. So she recommended genetic testing, and it came back positive for X-linked Alport syndrome.
While obtaining a diagnosis is key to providing early intervention, there are still no treatment options, and many patients continue to be misdiagnosed.
Many patients are misdiagnosed because the early manifestation of Alport syndrome is hematuria and proteinuria that can be misinterpreted as many other common conditions that physicians will see and not think of Alport syndrome. The stereotypical patient with Alport syndrome is the X-linked male. And because of that, it's common that physicians don't think of a female with signs and symptoms that are manifestation of Alport syndrome as having the condition. So it's very important to recognize that Alport syndrome is not just a disease of males.
Because of the genetic inheritance pattern, Janine's family was also tested.
With Alport syndrome, there are no carriers. You either have the mutation or you don't. My daughter and I both have X-linked Alport syndrome. Both of her children will be tested. All three of my sons, my sister is positive for X-linked Alport syndrome.
If Alport syndrome is suspected, the diagnostic process includes
a detailed family history, a urine test, a blood test to check your kidney function, a kidney biopsy, and genetic testing.
My current symptoms include continued blood and protein in my urine, and I have hearing loss.
Treating the complications related to the progressive loss of kidney function is very important and a standard of care, but there is a significant unmet need regarding delaying progression to the dreaded need for dialysis or transplantation.
Since I retired, I still had a lot of energy and enthusiasm for the renal community. I've had the opportunity to talk with nephrologists, scientists, researchers, and the work that they're doing is just amazing. And those that are looking for cures, I hope they keep looking. Meantime, I hope they remember we just don't want to be on dialysis. I had the opportunity to become a moderator on Alport Syndrome Foundation's private social media online community. So many of them are scared and devastated and lost about what to do next. And over again, it gives me an opportunity to tell them just how hopeful I am.
For more information on Alport syndrome, visit alportsyndrome.org.
And you can always visit our website, thebalancingact.com.
We'll be right back.
It's a rare brain tumor that can rapidly grow and spread into nearby brain tissue.
That's right, and treatment is a challenging task due to the location and complexity of this tumor.
Today, one man's story of his shocking diagnosis and his determination to survive.
Let's go behind the mystery of glioblastoma.
I'm a New Orleanian. I live in the Bend of Bourbon Street. I'm a real estate broker. I love to travel, seeing just about every country. I mean, it's a short list of the places I haven't visited. I love to collect art, heavily involved in all the aspects of New Orleans.
Despite being in great health most of his life, in 2005, things took a dramatic turn when he had a seizure during a house showing with clients.
I'm on the floor. They have an ambulance pick me up, take me to Turo, and I'm there, lying in the bed. And so they're going to do a needle biopsy, and that's when they found that I had glioblastoma. And I was absolutely petrified, of course. I mean, you're facing mortality, and it's scary.
The Balancing Act met with Dr. Sigmund Sue, who has extensive experience in the evaluation and treatment of neurological disorders in cancer patients.
Gliomas are tumors that grow into the brain, and they have 4 grades from grade 1 to grade 4. Grade 4 tumors are the most aggressive. Glioblastomas are very difficult to treat. They have a poor prognosis of about 20 months. They regrow despite our best treatments, and when they regrow, they are resistant to their prior treatments and cause more neurologic disability and eventually death.
Common symptoms of GBM depend on the location of the tumor and may include headaches, seizures, confusion, memory loss, dizziness, blurred vision, and frequent fainting.
The initial physicians will be doing a neurologic exam. They'll often start with a CT scan, and they will need to go to an MRI. In order for us to make a diagnosis by either getting just a biopsy of the tumor or to get a maximum safe resection.
Approximately 13,000 new cases of glioblastoma tumors are diagnosed each year.
The standard of care for treatment of glioblastoma after maximum safe resection is radiation with additional oral chemotherapy at the same time. Glioblastoma is so aggressive that even with the standard of care treatment, the mean time to recurrence is approximately 4 to 6 months. So despite best treatment, the tumor will start growing back.
Once Dorian received his diagnosis, he flew to a specialty care center in Houston, Texas for treatment.
So after surgery, I had to do chemotherapy and radiation. My family was here with me throughout my entire ordeal with the brain tumor. They were great support. You know, my wife would travel with me to Houston. I had a trip planned to Machu Picchu, and so I canceled the trip, telling the doctors, be assured that I was going to Machu Picchu, but that it would be at a later date. There was a lot of doom and gloom around me, and so people were pretty sure I was dying, that they were seeing me on the tail end of life. But I didn't feel that inside. And so I just had to take it one day at a time.
We have not made significant advances in improving survival for glioblastoma for the last 10 or 20 years. We believe why a lot of treatments fail or are ineffective for our glioblastoma patients is that the brain has a special protective barrier called the blood-brain barrier that protects the brain from poison, and most chemotherapies are considered poisonous. So chemotherapies that can't get into the brain, so they don't work. Blastoma is not surgically curable because the glioblastoma has left behind cells deep into the brain, then again grow.
9 months after treatment, they found out the treatment was no longer working and the tumor had come back. Because of that, I was offered a clinical trial position, and so I signed on for that. I mean, unbelievably fortunate that I was able to participate in the clinical trial. There's still hope.
The newest advance for the treatment of glioblastoma patients is the use of tumor treating fields to the standard of care of radiation and oral chemotherapy. We hope that new treatments for glioblastoma, which can cross the blood-brain barrier, will be more effective at delivering treatments to the tumor cells. Recent advances in next-generation sequencing of glioblastoma hopefully lead to new targets and new drugs. While these treatments are investigational, we're hopeful that these will lead to the next advance in survival for glioblastoma patients.
It was an interesting time period when I think back on it. It was the meanest, most obnoxious road stop and hurdle that I've ever encountered, okay, for sure. And I thank God that I had all those brilliant, wonderful, kind, loving doctors that were there to usher me through this unbelievable time in my life, because I wouldn't have been able to do it without them.
Neuro-oncologists and the brain tumor community are desperate for new treatments. Our glioblastoma patients deserve much better. We encourage patients to participate in clinical trials so we are able to develop the next generation of treatments for this deadly tumor. The brain tumor community are working our hardest to try to bring new therapies to the forefront for our patients through new research to better understand the basic science behind glioblastoma, which make them so deadly and difficult to treat. I'm
spending more time in my books, studying the art, traveling the world. It was probably about maybe 6 years ago that we went to Machu Picchu, and it was just a magical trip.
What a remarkable story.
Amazing, amazing.
Well, you can learn more about glioblastoma at cnspharma.com.
And you can go to our website, as always, thebalancingact.com.
And we'll be back right after this.
For over 200 years, Arnica montana, a type of mountain daisy, has been used as a natural pain reliever and as one of the most popular homeopathic medicines in the world. Today, many are looking for safer solutions when it comes to pain management. After all, 125 million Americans suffer from pain. Joining us virtually from New York with some insight and solutions is Dr. Ken Redcross, board certified in internal medicine, who takes an integrative, holistic approach to wellness. Hi, doctor. Thank you so much for joining us.
Hi, Olga. Good morning. Thanks for having me on. I wish I could be there with you, but it's still good to see you.
Absolutely, and we'd love to have you in the studio, but this is the best we could do right now. So, doctor, why are we, especially women, turning more towards natural solution when it comes to everyday minor health conditions?
About 80% of my practice are actually women. Not only that, women are the decision makers, and what we're starting to see as far as the new trend is that they want something that's topical for a pain reliever, not something that you have to worry about drug interactions or you have to worry about side effects. No, something that's a little bit closer to the earth, as I say. The other thing is, it's also nice to see that there's a new trend for alternative ways of healing that people are more open to as well.
What is Arnica and how does it work?
Arnicare works with the body. It doesn't mask symptoms like some of the other things that are over the counter. It's odorless. It's a really big deal for a lot of my patients. You know, you're going to soccer practice or gymnastics practice, and you can take it in gel, cream, ointment. The point is, there's a lot of different ways that can keep your family moving.
You mentioned gel. That's what I have here. You also mentioned odorless, which is great because a lot of topical solutions really smell, you know, medicinal.
It's the fact that it's not sticky. It goes into your skin really well, so you don't have that yuckiness that none of us want to have. And once again, we're not masking symptoms. We're actually working with your body. You know, a lot of my other female patients love the fact not only does it help for pain and swelling, but it helps for bruising. So who wants to have that bruising when you're wearing a nice summer dress or something along those lines? And so that's a nice little plus as well.
Odorless, not sticky, and it works.
I'm a Western trained physician, and so I've seen the light over the years to find out that there are alternative ways of healing that can make a big difference, such as Arnicare is able to do in my practice.
Doctor, thank you so much for your time. You're such a pleasure.
Oh, thank you, Olga. I can't wait. Stay well, everybody.
You too. God bless you. By the way, this can be found online at arnicare.com, amazon.com, and your favorite retailers, pharmacies across the country. Remember, you can also go to our website, thebalancingact.com.
Thanks so much for joining us today.
Remember to head to our Facebook page and our website and follow us on Twitter.
Make sure you stay safe, take care of your family. We'll see you next time.